Welcome back. Diabetes remission is equal to increased calorie expenditure, curtailing the calorie intake, neurohormonal changes which promote weight loss and increase chances of diabetes remission, and a whole lot of inspiration, perspiration, and a never-ending motivation. Healthy changes in 5 main organs lead to diabetes remission. These include decrease total body fat, decrease in abdominal or visceral fat, decrease in the fat content in the liver, muscle, and pancreas. These last 3 are very important organs involved in the causation of diabetes. All these things, 5 things together, lead to the strong punch of diabetes remission. This is possibly the most important question of the entire series. Patient profiles, which can help us determine the success of diabetes remission. These factors include a younger age, a shorter duration of diabetes, presence of obesity or signs of insulin resistance, absence of a family history of diabetes, a HbA1c range in between 6.5 and 8.5%. The patient is taking less than 3 oral agents for controlling their diabetes. Absence of complications of diabetes is mandatory before embarking on the journey for diabetes remission. And those who are loaded with self-desire and motivation to achieve diabetes remission, it really helps them go through the journey and successfully achieve diabetes remission. In these situations of profile, I would neither discuss nor advise diabetes remission. Importantly, these include patients with type 1 diabetes, pregnant ladies, the very elderly patients, those who are on complex insulin regimens, patient who's prone to hypoglycemia or has had even a single episode of severe hypoglycemia ever in their lives, presence of significant complications of diabetes or comorbidities which may affect their longevity. Because of the potential benefits of the diabetes remission procedures on multiple cardiovascular risk factors which frequently coexist in patients with diabetes, I recommend a thorough comprehensive evaluation at baseline. This shows a typical assessment plan at baseline for anybody who wants to enter into the diabetes remission plan. Very importantly, because of safety concerns, all, and I say all, must be evaluated for diabetes complications. The assessment at baseline also helps to convert the results into motivation, because when you see a progressive decline in the blood glucose levels, progressive decreased requirement of medications for blood pressure or that for cholesterol, it's very, very motivating, and this motivation will drive one to the successful achievement of diabetes remission. Your willingness for a regular scheduled follow-up with the remission team is a must. Answering the question that the diabetes remission requires a scheduled regular follow-up, so cannot be done in a one time. This regular follow-up entails changing in the strategies for achieving better results, regular assessments for parameters like total body fat, the regional fat distribution, laboratory parameters like a mandatory 3 monthly HbA1c till you achieve diabetes remission and a must annual diabetes complication screening. Importantly, it may not be scientifically correct to say that the diabetes complications will never happen even after achieving remission of diabetes. With a realistic possibility of diabetes reappearing, the diabetes remission procedures or processes must be continued lifelong if we are to prevent diabetes reappearing, or we want to continue diabetes remission all your life. Hence, the two very important parts of the diabetes remission journey include the shorter first part, in which diabetes remission is achieved, and a lifelong path of maintaining diabetes remission, keeping the blood glucose levels in normalcy without medications for diabetes. Aha! I almost forgot the grey areas in diabetes remission. And I'm sure in the near future, we'll have more scientifically driven and experience driven answers to these grey areas. These include: will diabetes never come back when diabetes remission has happened? Number 2, will the complications of diabetes never happen despite maintaining normalcy of the HbA1c over a long period of time? I give you 2 patient profiles. The question in my mind is, are the outcomes or the chances of getting complications of diabetes equal in these 2 patient profiles? The first patient is off diabetes medications, has a HbA1c less than 6.5% on a brilliant diabetes remission plan. The second patient, with a similar age, duration of diabetes, that patient also has a A1C of 6.5%, but is on certain medications for diabetes which have a potential safety and protective effect on the vital organs like the heart, liver and kidney. And finally, like the diabetes medications which are discontinued on achieving diabetes remission, will the same thing happen with the blood pressure and the cholesterol medications? I designed this series to empower you to choose wisely and take the best possible care for your health. Scripting this series has surely made me much wiser, and I believe it has helped you too. I'm really amazed at the positive responses all of you have shared for the series. And finally, whatever you do, please keep yourself healthy and safe. Live strong.